Welcome to Celestial Health and Wellness. Today's client has been experiencing carpal tunnel syndrome. For those that do not know, carpal tunnel syndrome is the numbness or tingling that is felt in the arm and hand. This is due to the impingement or entrapment of the ulnar nerve. The difference between entrapment and entrapment is meaning that the nerve is being crushed by muscle, and impingement is when the nerve is being crushed by bone. So most people feel the effects of carpal tunnel in their hand, where it's cramping or it's like a tingling or numbing pain, but it actually starts closer to the elbow. People are likely to get carpal tunnel are hairstylists, students, desk workers, and that's mostly because of improper posture while doing these activities. Gamers are another individuals because they're constantly using their digits without stretching their bodies. We are entering into the integrative portion of the session. I am using a massage gun on the muscle tissue of the forearm, mostly focusing around the elbow. You'll see I'm using my thumb as a guide, not only for me, but also for my client, for myself, so I can feel what areas need to have the gun's attention the most. So as for my client, I hold my thumb there also as a way to minimize some of the vibration going down into the hand. Because again, that's not the area that we're focusing on just yet. Again, it's trying to be very concentrated on the muscles that I'm working on. Now, there are multiple muscles that make up the arm, wrist, and hand. I will show them above here. All right, so this is the flexor digitorum superficialis. Now, as you can see, it starts at the elbow and it goes all the way down to the fingers. It's called a flexor because it is the one that brings your fingers to flex it into a fist. Now, in the illustration, you can see as it passed through the wrist, that little canal that's by and along the wrist, that is the carpal tunnel area. So it's one of those areas when those muscles become overworked, those are the ones that will trap the nerve, thus resulting in the numbing and tingling feeling that you will feel down your hand into your arm. All right, and the next muscle of the forearm is the flexor carpi radialis. So this one helps with not only with flexion, but it also helps with adduction, with turning your wrist over. Okay, so you'll see here that I'm actually putting magnetic acupressure cups onto my client. I am putting them around the elbow, again, to focusing on the areas that she's having most problems with. Now, the acupressure of the magnetic cups will help to alleviate some of the pain and inflammation she's having around the elbow. All right, the next muscle is the flexor pollicis longus. This is the muscle that helps to bring the thumb into the flex position, or so you can make a fist. All right, this muscle is the pronator teres. So this is the one that allows for your hand and wrist to flip over a 90-degree angle. The palmaris longus helps to flex the hand as well as to tense the flexor rectinaculum. So the flexor rectinaculum is the transverse carpal ligament. This ligament is used to create the carpal tunnel that your muscles flow through. And because that is what creates the tunnel, during carpal tunnel surgery, they cut that ligament in order to try to create more space. But as I said before, if you're not addressing the cause of the inflammation and what's entrapping the ulnar nerve, you're going to have symptoms of carpal tunnel again, just because your hands are going to continue to inflame. This muscle is the pronator quadratus. This helps to pronate the hand. All right, this is the flexor carpi ulnaris. This one helps to flex the wrist and adducts the hand, so bringing the hand closer to the body. And this is the flexor digitorum profundus. This helps to flex the wrist as well as flexing the middle through pinky finger. Okay, the final muscle that we're going to discuss today is the brachioradialis. It helps to flex the forearm at the elbow. Okay, these images above, these are trigger points. So the X's are where the muscle bed is starting, and the blue glow is where the pain is felt. This is what I mean when I say that just because you feel it in your hand does not mean that that's where it originates. So that is what the importance of stretching and getting a massage on a regular basis can help you with. This has been Celestial Health and Wellness. Thank you for watching. And if you're not doing so already, please like, follow, and subscribe.